A geographic scientist is a person who is interested in the way different objects sit on the landscapes. Most of our research has been what you would generally call environmental sciences. There's an expansion of environmental sciences into environmental health. Questions to do with air quality, questions to do with water quality, questions to do with uranium and arsenic in your water supply. All of these things are mappable. We now have new technologies that allow us to produce maps that we couldn't produce before. We're flying over the landscape with one set of technologies, and at the same time we're putting instrumentation into the vineyards and in other places to watch what are the processes in terms of changes in microclimate and things like that. And then where the computer comes in is, so you've got the top down from the aircraft or a satellite point of view, you've got instrumentation that's dotted around the landscape. You bring those two together and you map the relationships between what you can see from the top and what you understand from the bottom. And that's called geographic information systems.
When I asked my mentor, what should I do now? Now I have a Ph.D., what should I do? And he told me, I'm not going to tell you what to do, but what you should do is go out there and find one of the most difficult things you can find that you like to do and stick with it. And I thought that Alzheimer's disease was as difficult as it gets. Alzheimer's disease is a disorder where patients develop problems with memory, with language function, with visuospatial function, and it is believed that they do have these difficulties because brain cells die for reasons we don't know. So you can see the difference between the two brains. The normal brain is quite plump, it's juicy, whereas the Alzheimer brain is shrunken quite a bit. It is very important for us to have a brain bank where people who wish can donate brains for research purposes so that we are able to look in the brain to see what are the changes, so that we can find various targets in the brain to make molecules for diagnosis and for treatment of Alzheimer's disease.
Our research focuses largely on the early detection and treatment of autism. When we communicate with each other, it's almost like there's a dance going on. And there's a certain rhythm, and we try and get into the same rhythm so that we're with each other. And one of the things we're trying to help people with is how they can get into a rhythm with the child that doesn't frighten the child, but rather sort of pulls them out and engages them in whatever's going on.
Paint. Perfect, Shelley. That's lovely shared emotion.
We literally see children develop speech and to start using speech to communicate.
Good night, Macy.
Good night, Mom.
Good night, Tiger.
Now we want to embark on a major province-wide initiative where we help parents learn these skills.
Up. Up.
And we also want to start teaching early childhood educators, teachers, all these people can learn these skills, and this is going to allow us to integrate these families and children much better into our communities.